our City Council Committee of the Whole meeting for Duval. It's Tuesday, July 7th, 2020 at 5:33. With that, I call to order our committee meeting. And the first item is good of the order. Are there any council members that would like to speak on good of the order? Councilmember Napland.
I just wanted to say that I attended several of the AWC webinars. One of them was a networking meeting, and it was very interesting if no one else attended one, or maybe a few of you did, but they actually, mid-Zoom meeting, they bring it all together, and I think it was Zoom that it was using. They break you out into small groups, which was just all of a sudden you're in a small group with, you know, I think there were maybe 7 or 8 other city officials, elected officials in my group. And actually, I think some of them were also maybe a city administrator too. But, and then we all had kind of a moderator, and we went through and we answered questions and got to know each other a little bit. But the one that I attended, we were talking about CARES funding, how cities had been utilizing the money. And everyone went around and kind of talked about some of the different innovative things that they were doing. And a lot of the cities had worked with the council, or some of them had a committee that included, I think, community members and other people to help kind of decide how the money would be spent. And Sean probably knows a lot of this. He's probably been hearing about it. But several of the cities had a program where they were giving small grants, you know, maybe $2,500 to help some of the smaller businesses. And they were focusing more on 5 to 10 employees, kind of that smaller range, to help them maybe retrofit their business, help purchase supplies that they need, such as masks, maybe a temperature taker, but they were smaller grants. Anyway, it just got me thinking more about that we do have potentially some money that we could use for a program such as that. And I'd love to have a conversation about it. And I know I'd asked before this is coming up. You know, and having that conversation, so we don't get down to the end of the deadline of spending money and trying to figure out what to do. But it seemed like most of the cities had already moved and had been working on how they were going to spend the money. And I would just like us to make a plan as soon as possible. And it doesn't mean we need to, you know, we don't know how much we will have left over, but at least have an idea in place so that if we get into a situation where we realize we will have money left over, after we, you know, make sure our employees are in a safe working environment and all of that. But anyway, I'm kind of being long-winded, but I have quite a few examples from cities, and maybe I could pass them on to Sean, of kind of their application program and how they structured their grant program. But I was pretty excited about it. And I just think of all our small little businesses that probably are having to spend a lot of money just to stay open, and they're having to open even at reduced volumes. So I'm imagining it's a
Well, thank you. Mayor Overlander, do you have input on it?
To that point, you know, we've talked about it a lot. It's about getting staff time to dedicate to it. Staff, finance staff, et cetera, have been tied up on other things, including things on this agenda this evening. So we hope to have something in draft format to the council by the next meeting, because we have to get something rushed through and approved in order to be able to expend the funds by the end of October. But with the severe short staffing that we have, and now multiple employees out ill, it is a stretch. But we've also asked for, through Sound Cities Association, all the copies of programs that have already been developed, so that we're not reinventing the wheel. So expect something in the next 2 weeks on that. But that's also going to mean other things have to go be put on hold. And so please be aware of that. We put other things that on hold for the things that are on the agenda, some of the things on the agenda this evening. And so it's a big lift, because it's not just CARES Act. It's county funding through the CARES Act, as well as direct grant from Councilmember Kathy Lambert. So we have 3 separate programs that we have to get up and running within the next 30 days. So it's a huge lift for our small staff, but we're going to get it done.
Great. Yeah, I think it's a good suggestion to be able to take a look at that and have input. I wanted to welcome Council Member Langle, who's here joining us now. So we have 100% attendance. We have begun our meeting and we're just now on good of the order. Are there any other council members that would like to bring something to the table? I don't see any other hands. I've got a couple of brief items. I do want to also welcome Director Mason and our Emergency Preparedness Manager. Mr. Tozer is here with us this evening. The 2 items I have, I just wanted to remind folks that you do have an invite as a panelist for an executive session tonight. So we'll begin our city council meeting at 7 o'clock, and at some point right around 7:30, I believe, we would take a break from the council meeting, go to our executive session. So on your emails, city emails, oh, Jody, you've got your hand up.
I was going to say, it's not necessarily at 7:30. You're going to go out to executive session. I scheduled it that way just in case we happen to fly through the rest of the agenda. But it is not, the exec session is not scheduled until the end of unfinished business. But just for scheduling purposes, I had it quote unquote start at 7:30.
So when the mayor's ready to have us go to executive session, we'll just go to that email. There's a link on it to get you right into the executive session. Finally, I wanted to remind folks that we also have a special meeting on Tuesday, July 14th. That's next Tuesday. That meeting is to hear from our department directors. They're going to do quarterly updates on their departments. And we've had some illnesses, so I don't know if everyone will be there, but I do want to encourage you to attend that. And I think it'll be really important in our process, just in good communication, knowing what's going on as council members to hear on a quarterly basis. So this is our first one, and I'm excited to get that started. Well, with that, and not seeing any other items for good of the order, we can move to our next item. Mr. Tozer had asked if we could swap the coronavirus update and the retreat recap because he's had a pretty busy day. I told him I didn't think that was any issue. So unless I see a concern from council members, we'll go ahead and make that change and do our retreat recap first. And I don't see any issues, so we'll go ahead and make that change. So council retreat recap. So on June 30th, council got together to really discuss and go over what council budget priorities are for the 2021-2022 biennial budget. We were fortunate to have Mike Bailey join us, and Mike walked us through a process that included answering some questions. Specifically, the key questions that he asked us was number one was, what would you hope to emphasize as a city in the next biennium budget? That was really a question about if we have stable revenues, increased revenues, what would you like to help emphasize? And then the second question we were giving is, what would you be willing to de-emphasize? And of course, that would be if we have scarce or reduced resources or revenues. So it was really, I thought, a very productive evening. The mayor joined us. We had an opportunity to have her feedback, and then Mike provided some. That overview I sent out to council members, and I didn't have any feedback or changes. So at this point, unless someone has something specific, we'll go ahead and take draft off that, and we'll publish that to the website, as well as I'll ask Jody to bring it back at our next meeting and actually have it part of our COW attachment so that citizens have easy access for it. I took the liberties to put these into some categories there were a lot of really insightful and good items on there. Some of these topics, I put one under what I call responsive government. That's just a government that is listening to our citizenry, that is makes us available. And the key things that were brought up was sustainability, talking about maintaining appropriate levels of staffing, especially now with COVID-19 and concerns about our revenues. Sound financial planning and practices. Capital investment was another key topic. Clear, attainable work plans that match our priorities. Citizen accessibility and engagement. Many council members have been discussing how important it is that we engage our community. We have, with the appreciation of Councilmember McHenry, who has helped set up, almost monthly where we could get together with our citizens. But we have talked about having some special meetings as well to be able to meet with citizens and talk with them. I know the mayor's also talked about doing a survey at some point to be able to engage citizens that may not be able to attend meetings. And finally, we talked about support for human services. And again, this is just a quick overview, not so much for council, but certainly for our citizens that may want to listen in and weren't able to attend our special meeting. Another one was what I called improved mobility. This really had to do much more with people being able to get around the city. Key things talked about were transportation, our street system. We do have a transportation improvement plan, which is a big part of our trying to upgrade our sidewalks and our streets. There was some talk about bike lanes, and those were the key items under that. Safe community. We talked about safety, make this and maintain a safe place to live, work, learn, and play. We talked about street lighting was brought up, and there was some mention, just especially with COVID-19, how important it is that we're watching over the health of our citizens. And certainly recently we've had to sadly cancel some of our special events that the community dearly loves, but important part of maintaining their safety. We talked about having a vibrant economy. Key items we talked about was economic development. Tourism was brought up as something we could expand on. Support for our downtown businesses, very important. I know the mayor's been meeting regularly with our business community, especially with the COVID-19 and what we can do to help support them and maintain a healthy downtown. And lastly, and this was actually a lot of items, was talking about our existing infrastructure, what I called our built natural environment. We've all appreciated living out here in a rural setting with the farmland and the trees. So those items included, our physical infrastructure and included community parks, trails, and open space. Key things, services we provide with sewer, storm drains, safe, reliable drinking water, our transportation network, and some improved traffic flow. And one that we weren't specific on, but one I added in here because I thought it was more a reflection of things that we've all heard from our citizens, and that was preserve our rural character, our natural beauty, and our small town feel. That's something we hear pretty regularly from our citizens. Now, our actual list included a lot of other things. We certainly talked about the size of the pie, which is our budget. Under final thoughts, and I'm going to share these because I thought they were important. Under final thoughts on our priorities, budget in line with our known sustainable revenues, budget conservatively, basic services may have to be good enough, needs versus want during this time, focus on efficiencies, reconsider automatic assumption of increases to parts of budget, and have a base budget with possible additions or subtractions tied to thresholds. I did appreciate the mayor weighing in as well during our meeting. She had three what I thought were very important points. The importance of technical advancements that are key to our city, both keeping up with technology, being more efficient, and having access for our employees and our citizens. She brought up the importance of maintaining Summer Stage. That's a very big event, important event to our community, and trying to find ways during this the virus to be able to still bring people together with social distancing. And finally, Mayor had also mentioned increase in revenues through fees, that we were looking to, ways to be able to continue our key services. And that's one that we certainly can look at. And then finally, Mike Bailey, who was our moderator. Mike was a retired finance director for City of Redmond and currently works as a consultant for municipal research services. It's a group that cities throughout the state use. And we certainly use pretty consistently here for advice and input. So Mike, he had 3 items as well. He talked about having measurable outcomes. So we often have things we approve in the budget, but it's important that we can measure that we're actually getting what we're paying for. He mentioned how important it was to have collaborative conversations so that we're more productive as we move through the budget process. And I believe that includes having collaboration with our citizens. And then finally, he mentioned that whatever we're doing in the budget, make sure it's benefiting the community. Sounds pretty basic, but probably about as important as you can get. So that's the overview. I did want to ask council members, do you want to have some input? Are there things I left off in that brief overview, key things that you want to bring up as we're talking about council priorities for our next budget? Oh, I see the infamous hand from Councilmember Brudnicki. Diane?
Yeah, maybe I missed it, but I just want to make sure we covered in the budget the portion I had brought up in regards to budgeting for staffing and sustainability of that, since that is probably the largest portion of our budget. So that's
thank you. I'll share what we do have. Now, this is on the notes, not in my brief overview I did just now, but in the notes, in fact, the very first item, it says sustainable budget, maintain current levels of staffing. This was mentioned more as to have proper staffing levels, which may mean more than just maintain current levels. Did that help cover it for you?
Yeah, I think I was thinking also there are a lot of things we want to get done, but we still struggle with having staff for that. A good example is economic development. We can never, we've tried to launch that so many times, I think four times already. And it really is difficult to do that if you don't have staffing for it. So that's just one example, but we can look at other things around the city that will need staffing to achieve the goals that we want to achieve. That's all.
Thank you for that. I've heard that how important it is during this time with uncertain revenues and things, that a top priority is really maintaining our staffing, and the staff is the ones that are doing all of our work. Councilmember Langle, did I see your hand up?
Yeah, I think I'm unmuted. This doesn't change what you put together at all, but when we talked about the pie, I referenced the difficult development word, but I wanted to clarify what I was trying to convey, which is that once we decide, and our comp plan is the place ultimately this gets framed, but once we set a real vision for what this city needs to be in its next decade, I guess, and that includes everything from, well, the things that you have all summarized. Zoning is one of our strongest assets. And what I meant by that is you have to have zoning to support whatever that future look is. And it might be a place that's bigger, it may be a place that isn't. And when you look at your zoning, it's got to dovetail with your financial strategy. And I'm just going to stick with the notion of economic development and tourism. If that's something that's an image you want to pursue, then you've got to make sure your zoning will allow for that. And it might be things like you look at the parking requirements. I know that's something that's been discussed in a different context, but that was really my point. These things have to somehow support each other or they don't work. And, you know, in terms of economic development specifically, it's very difficult to afford internal capacity for like a full economic development department or something like that. I really encourage us to be looking at that in the context of partnerships, because there's some really good economic development resources and entities out there. And actually, in one of the AWC things that came out recently, there was even a reference to economic development organizations. So I agree with Councilmember Brunecki's desire around economic development, and I want to figure out a way to go there. And zoning's just a piece of it. It's probably our strongest asset, is our ability to zone our land to achieve whatever our desire image is for Duval in the long run. And sometimes staying small is what we want, and sometimes doing something different is what people want. I don't know the answer to that one.
Well, Dot, thank you for adding that. We did have a look at how land use supports or does not support goals, but I think that larger picture about land use, the example you gave with parking requirements and the partnerships with both business, private groups, and our community is going to be a huge part of our being able to move forward. And how we work that out is always a challenge. But I think it's an important part of as we grow and try to have a sustainable budget. Other council members that want to weigh in on budget priorities that we discussed? Looks pretty quiet there. Any questions? All righty. Well, Sean, it looks like we're ready to move to our next item. Are you ready to go? Well, thank you. So with that, our next item is coronavirus COVID-19 emergency update with our emergency manager, Sean Tozer.
Good evening, Mayor Pro Tem, Mayor, Council. Nice to see you all. It seems like it's been so long for me anyway, but I just sent out not too long ago, and I've already revised it slightly just to keep you guys guessing, but I did send out the slide deck for tonight. Again, the last time I think I did it was on June 1st or somewhere right around then, if that was the last date. So it's been a little bit since we've done this. So we'll jump right into it here in a minute. You can see I have my neat new headset. It's really cool. I recommend it. You can hear things really well. All right, so here you go. So here we are, July 7th, 2020. So again, like I mentioned, the last update I did was 6/1 or in and around there, or maybe that was the date this map was updated, but you can see where we were at then and then with the current situation where we're at now in King County. So we've seen kind of a sharp increase in cases, and we'll get into some of the details about the makeup of that and sort of how things have changed recently as we get a little further along. But again, kind of toggling through from just over a month ago to today, we have a pretty sharp jump in cases, but generally there's some other indicators that are good. I mean, total tests are up. You know, our testing capacity is better. The percent positive has come down just slightly. Again, there's some good things in there, but the cases have definitely spiked. And I think even King County had its largest single day increase here just the other day, or it was the state. Statewide is a very similar situation. So again, based on what we did a month ago, you can see where we were to today. Again, a sharp increase. Hospitalizations, all the indicators are up, but the percent of deaths has come a lot further down. We can get into that in greater detail, but you're seeing sort of that picture develop of how things have evolved here over even the last month or so. For current trends, and again, this is an important indicator. It's important for reopening and just generally capacity, but you can see the volume of tests has increased quite a bit from, you know, this bottom line. Again, I think you guys can see my cursor here of around 5,000 tests a day. You see we're, you know, very consistently getting up near 10,000 tests per day or even beyond that. So the testing capacity in this last month or so has increased a lot. So that means we have more results to sift through. It's important to keep that in mind. Here's one of the indicators with hospitalizations. We were already on sort of a downward trajectory, and that's actually kind of flattened out. And so it might be bumping up a little bit, but that's not exactly what we're seeing. We've seen a change in the demographics of what the virus is infecting and how it's being handled in society at large. So another important indicator there that the bed capacity has been maintained, and it has actually gotten better even as we see jumps in cases. The current trend for what is this one? Illness onset. Oh no, we're getting ahead now. Illness onset, I guess. I think, oh, this is deaths. So there you go. So there's the deaths. You see that big spike there early on at the end of March and April. Again, a lot of scary stuff was going on, and then moving and tailing off as this has changed demographically. And there's been better controls and testing and other things happening. So this was a little bit that I added in there that was not in what I just sent out to you guys, but I thought was important information. I forwarded this along to our admin group, and it just helps to paint the picture. But we get usually at least a weekly email from the Department of Health Government Task Force. And this was interesting because it's been part of our conversation here for the last couple of weeks, but looking at how the cases change in the spikes, in here, they talk about, we went from 40 daily cases in mid-June to 138 daily cases. Those are very concerning statistics, those big jumps, those big increases. Again, as we've looked at, you can see how that's sort of correlated to an increase in testing capacity, so additional results. But again, it is still concerning in a lot of ways. And then one of the big things that's changed is the big increase in demographic, where this has shifted far down into the age range of 20 to 39. So a huge increase in that population, whereas before this was affecting a much older demographic and with a lot more negative outcomes that you're seeing it shift quite a bit. And that does have some sort of effect on both the hospitalization and the death rate that is being reflected in that. And then also I added this other little snip of an email, just thinking it was important. The 2% of the current COVID cases occupy ICU beds. So that capacity, that surge capacity that's been very important as people move forward has been there. The hospitalizations have generally been down and the bed availability is there. Again, that's indicating that there's less severe outcomes among the population that's being infected right now. That doesn't mean that won't change. And again, doesn't mean that the positive tests right now are hospitalizations right now, but it is again an indicator. And this was just a snapshot from a particular day. Again, a lot of those negative outcomes and a lot of the deaths were disproportionately affecting long-term care centers. So senior living facilities, group homes, things like that, that is where there was a very disproportionate negative impact. So what about Duval? One of the neat things, I hesitate to say neat, but it's been interesting to be able to, as they've gotten more information, they're sharing more information. So now, whereas we just had a picture of the 98019 zip code before, and now it changes it by city as well. So they have updated some of their information. And a couple weeks ago, they took away a death that was attributed to the 98019 zip code and a case. Now we've subsequently had a couple more positive cases, but no deaths associated now, which is obviously a good thing. I'm not sure where that ended up being assigned to, or if it was just a mistake in general, but you can see a very specific, our kind of granular detail. I mean, even to the almost day range, you can see where we've had positive tests. And then also in this summary, I snipped this out of the Excel spreadsheet that you can download from Health. You can see the 98019 zip code versus Duval City proper, and tests versus the positive rate and hospitalization. So again, we're showing no hospitalizations either with the zip code or the city proper, or deaths with the zip code or city proper. And again, a handful of cases that are related. So, I mean, it'd be better if all those were zero, but I think we all know that's unlikely and probably unreasonable, but it is generally a good indicator, and it gives us a very good picture of where we are and how we're doing.
Hey, Sean, you have time for a question?
Of course I do.
When we talk about long-term care facilities, that doesn't include group homes, group family homes, does it?
Some of it does. There's a whole list. I think it's more senior living, but there's a couple specific ones in here I won't mention. But yeah, I think it was congregate settings. That's what I meant to say. Congregate care centers.
Yeah, well, thank you. I see on that last list, it didn't show any deaths in Duval, but I had heard we had had one death in the past, but it's not showing up now. Do you know if it's accurate that we have not had any deaths?
To the best of our knowledge, they had removed, so we had a death that was attributed for, probably near a month. And then they changed some things in the numbers. They looked through their data and that was removed along with the associated case. So we went from 21 and 1 to 20 and 0, if that makes sense.
Right. And then finally, we did have one of our citizens who's online that asked or said they really appreciate joining the session. And the question was, is this COVID-19 update presentation posted for public view or will it be? I understand that our items like this are posted, but where would people go? So if I'm a citizen and I go to our city website, where would I go to find this presentation?
So I did send this to Jody this evening, and Jody, can you tell me, you can wave or blank, but whether these go into the council, the files on the website? So there's that site tools and documents link.
The presentations have not for your COVID stuff because they usually change between the time you send them and the time you present them. But if you want to send me the final versions, I'm happy to get them posted. I wasn't sure if you were also posting them in the COVID pages of our website. I'm not sure which is the most appropriate, but we can figure that out offline and then we can make sure that they get posted tomorrow. They also, any videos of these meetings that have these presentations actually show up in the video as well.
Great. Well, thank you. So we'll have them available online under council presentations, maybe on our COVID update site.
Yeah, we'll find a good place for them and make sure that they're out there. And then since Sean also doubles as our PIO, he can make sure to mention that in our social media platform as well.
Great. Well, thank you.
Yeah, no, that's a great point. We can absolutely link it in. I preferred almost a link from the COVID landing page to, where we generally put documents and presentations. So that's a good idea. No, it's not been put up there yet. So well taken.
Just to know, all presentations that are in city council, in the city council meetings are supposed to be posted online. So if there's anywhere missing, we'll need to make sure that gets taken care of.
Thank you, Mayor. Well, Sean, you can move forward with your presentation. Thanks for taking my question.
My pleasure. Yes, please wave and yell at me with anything. No problem. I'm focused. I'm lasered in here. So
I do have a question though, regarding phasing. Is there any indication, because so many businesses need to have phase 3 in order to operate? And is there any indication that, like next month or September? I mean, I'm definitely one of those businesses that I cannot operate until I get into phase 3.
You asked the question at a perfect time, Diane. It's almost like I paid you to do this. But so this is from a fancy free and feel good time when the phased approach first came out. And so you can see there was even dates attached to it then by, whoever, the governor's office or whoever. The office of Governor Janesley. So there was actual dates. So phase 1 began May 4th. And then they had sort of these anticipated dates. Well, King County didn't make any of these. Right. And we know that generally the entire thing is paused right now. There's nobody moving forward in phases allowed by the state at this moment. The last word that I heard regarding King County was that King County was not even going to apply for phase 3 until July 31st at the earliest. So, and that was, a week and a half, 2 weeks ago, right after my vacation. So I don't know if that's changing. I don't expect us to move forward very fast. And Mayor, I don't know if you've heard anything else along those lines?
Well, I just watched a chunk of the governor's press conference this afternoon with the State Department of Health, and based on meetings with the county executive and Seattle King County Public Health last week, my biggest concern is going backwards because of the huge surge in cases that makes us much higher than we were at our previous peak. It's clear we're still in the first wave. And my biggest concern at this point is that that we might have to go backwards, as we've already had to do with our city operations today. And that's being proactive and making sure that we're doing everything we can for health and safety. I think the biggest issue is going to be making sure that businesses are enforcing the law. We have plenty of businesses around the state that are flouting it. And plenty of people that have reduced their guard in regards to the virus. And that really worries me for the coming months. Not to sound like a Debbie Downer, but this has gotten pretty serious nationwide. And the former director of the CDC stated over the weekend that we pretty much lost the battle at containment at this point. And so I'm very concerned about what that means for the future. The good news is that many of our businesses have found ways to adapt, but I don't know that that adaptation will be sustainable if we can't get to phase 3, and especially if we roll back.
Yeah, and this will tail in nicely toward the end. We can talk a little bit about some of those priorities for CARES funding and some of the other possibilities that we might have available to us. And to address what the mayor mentioned, and I know there was an email that was sent out earlier, but we are kind of taking some steps. We're rolling back a couple things with on-site staffing. I know you guys were made aware of some of that, but we're going to try to really limit again what's going on at City Hall and Public Works Engineering. We've gotten back to a lot of normal operations, and we really need to sort of limit some of our exposure with staff members there. So having a couple possible tests out there and possible vectors for infection, we took the step today of asking people again to go ahead and work from home, non-essential activities, anything that's essential will be cleared through a supervisor for work on site. We believe we can operate like this. We did this earlier and it was very effective. And again, it's the best measure that we can take to protect our staff. The other thing that we implemented today was sort of in line with the general order that has been issued by the governor that went into effect today, where we're also going to ask that all staff members, if they're in a building and they're not alone, they have to wear a mask if they're not working on site. And that is not a requirement. It's an extra step we're taking. Yeah. Again, relative to our situation currently, and just to make sure that we're providing every step that we can. So, and then we'll be reevaluating that through next week as things move forward. Again, this isn't to not perform work. This is just to make sure that we're doing it smart and we're taking care of our folks.
Could I ask one more question in regards, because I don't see educational facilities on here, and I was just wondering with schools, is it going to be by city or something, or is it going to be something they're going to open it up like the whole state? How do you know how that's going to work with the schools?
So each school is kind of developing their own contingency plan. I don't have all the details on that, but I know that Riverview School District has looked at what their contingency plan would be. And so it's a kind of a staged approach where certain grades go in like first through, or kindergarten through third, I think go 3 or 4 days a week. And then fourth and fifth and sixth go 3 days a week or 2 days a week, and then it goes down from there. So no, it's not everybody in all at once. It's definitely heavily modified right now. That doesn't mean it, maybe it could change for the better, maybe it could change for the worse, but they're making contingency plans. And it seems to be some guidelines, but then how the districts interpret it and how they choose to do that is up to some individual districts.
Okay, thank you.
Sean, this is
Yes.
Councilmember Naflin. Do you have a slide that shows what phase 1 looks like in our city and what phase 2 looks like? I'm guessing you presented it at some point, but I'm just trying to understand exactly what the difference is between phase 2 and phase 1. I don't know if you could provide something like that to council.
Yeah, I'm sure I can. I deleted one of the slides out here that was more detailed on phase 1, phase 2, but again, we also had modified phase 1. So that really changed things. The big differences were in capacities for restaurants and types of businesses.
Oh, I'm talking about internally for our city to be in phase 1 for our city of Duval, not
City government.
not the larger, but for our how we're functioning as a city.
Got it. Yes, I can.
Function.
I think I have some memos or something I might be able to send along, but a lot of our work was still always essential. And so we kind of just worked our best way of maintaining what we could on site and maintaining things that were going on, and then also keeping as many people as remote as we could. And then as some of the phases with business and particularly obviously development started being released, that brought us to bring some more people in. And again, I think there's a comfort level. And I think we kind of got used to, things were looking like they were all improving, and folks have a tendency to want to get back to normal. So,
okay. Yeah.
so yes, I can send you more information.
Yeah. Cause it referred to in the email that we were going back to phase 1, and I didn't know what that meant in regards to City of Duval government functions. And
Yeah, it'd be more along like the stance that we started in,
Yep.
where the default is you work from home.
okay.
And again, not for operations, but general. And if I find something really detailed, I'll send it to you, or I'll detail it out.
Okay. Thanks.
All right. So as I mentioned in the safe start, I think this is the most recent. Again, everybody's paused. So we're stuck in phase 2 along with a bunch of other people. Nobody's ever going to get to phase 4 right now. Phase 3 is where everybody's hoping to get to. And on this slide, I've showed this to you every time. I think I have something in here at the end, but I just wanted to mention that we did have our kickoff exploratory call / kickoff. Dana was in it with the state military department for COVID. So that's a good step. We talked through some processes about how we would develop, they call them project worksheets, but really it's just claims, to think about it another way. A project to them is buying masks, or a project where, for a project manager like me, that's not a project, but it's just tasks. So I think we got a lot of good information out of them about how they'd like to see information presented, and some of the details. We have lots of time to work through this. This is still an active disaster that is occurring right now. So we'll see how we all work through that, but it was a good step last week to move things along. Okay, financial impacts. It's been a long time since we looked at this stuff. All this bit. We track things. We do our best to track stuff and sort them out accordingly. Here is from Dana, the last AP run for incident expenditures. And I didn't look at the detail on what these items were. Sometimes I do, but I kind of threw this together here with my day-to-day at the end. But I mean, you see that expenditures have generally just come down. We're spending less on things because we have more things on hand. We have stuff in stock. We've already provided them to staff members. That's good. I don't see us having huge, barring something we don't understand, we don't have huge needs at the moment. A lot of what we've purchased, a lot of what we've acquired as far as personal protective equipment, has been done through the county. And so we've made requests to the county, which has fulfilled it through the state and then sent it down to us. Those are costs we didn't incur. Those are costs that something was provided to us. We may get charged at some point in the future. We think that to be unlikely, because what the county has generally indicated is all of those costs are eligible to the state. And so while they track it, those are all costs that is a cost to them. It's something they use forward in their own claims to FEMA. So we've been pretty fortunate to acquire a lot of things through that resource request process. Financial impact for incident staff costs. So again, this is a roll up of where we are and what we've done to date. Most of my time, the last couple of weeks since I got back on vacation, has been dedicated to public works. We've had a water job, and there's just been a bunch of stuff going on that I haven't been able to not pay attention to. So I've put very little time into this generally for the last couple of weeks. Just haven't had the time to dedicate. We've been forced to address other things that were going on. So you see that reflected in some of those hours where there's a lot less regular hours or overtime hours, or just hours in general from myself or anybody else. So again, you're seeing the roll up of those costs. We're in discussion with FEMA and knowing how we're going to assign some of this for CARES to FEMA, what will be eligible. Our state EMD program manager did say that he was going to look into some of the dedicated to the incident costs, like my direct regular costs. So we talked through that process and about how I was brought from one total different job into something else that was dedicated to response that was unusual. So he was going to look into that and see what he thought about that being FEMA eligible versus CARES eligible. Any questions on those two slides yet? I hear none. Oh, nuts. I didn't change this one. So we do have something for revenue. Dana did update the AR, but I forgot to stick it in here. And I didn't even look at it. So my apologies. I know we also, in the financial impacts for revenue, there was also a new line added, and it wasn't much dollar figure, but it was another Big Rock ball field rental line. So it adjusted it up just a little bit, I think, to $46,000 or $47,000 in projected loss revenue for the ball fields. And I don't remember any of the details about the utility billing, unfortunately. I put this slide in here. And again, the obligatory warning, what you're going to get is that, oh man, this is an estimate and only an estimate. So this is something that the finance committee had asked for me to do. You know, we talked about it a number of times, and I had provided it right prior to my vacation, right before I left. And I have not really looked at it since, but I wanted to share it here in this update, just again, to give you guys an idea. I think it informs some of the other discussion that we're having here. But this was an attempt to look at current costs incurred, project what we thought were reasonable future costs, and then assign them amongst where they could be eligible. So this gave us an idea of how to roll those costs down from FEMA, what FEMA may or may not accept, and then would apply to CARES, et cetera, et cetera, et cetera. And then some that are ineligible or unassigned, something we haven't found. So you see that breakdown. Again, I wouldn't live or die by these numbers by any means, but it's a representation of where we are. So you can see some costs that I currently think are maybe unassigned, or I don't have a place to stick them, that could just be our costs. There are costs that I'm showing that I think are clearly eligible for FEMA and will be reimbursed, and then how CARES backfills that. And then in that bottom three lines, you can see what's CARES available versus assigned, if all my numbers are correct, which surely they won't be, and then what would be available. So that's where I think some of that discussion about how do we look at providing, and this was again a projection out into October, November. So how do you look at utilizing some of that, what could be available funding, and what are the priorities as far as community programs? Is it direct aid to businesses? Is it, again, human services grant programs? What is the proportion of one priority to the next? I think those are super important conversations. And to the mayor's point, you know, we're trying to look at getting those programs in, and it definitely involves input about priorities to make sure we make the right decision in a timely fashion really quickly and get those dollars out the door. Otherwise, they're not good to anybody. So, and that is all I have for my presentation.
Thank you, Sean. Other questions for emergency manager? So I don't see any. Sean, are there any updates for citizens? I know we've opened our parks. I'm sorry, Dot, you have a question?
Mute.
There we go. I just have, let's see. Yeah, I only have one question for Sean, which has to do, I know the contract and all that, we've already authorized it. When do you plan to start invoicing?
For COVID?
Yes.
So we talked with them about doing multiple projects. That was part of the discussion, multiple projects. And so one would be for costs incurred up to probably June 30 something. So yeah. I have to focus right now on the storm incident. So I have due dates that are hardline on that, because there's also that storm one that damage assessment and that cost one. So that actually has a shorter timeline than this one. But yes, we would intend to apply for everything known to like June 30th, maybe within the next month and a half or something.
So you're saying September?
Perhaps, yeah.
Thank you, Dot. Shauna, we've opened a few things up, our play areas at some of the parks, and I try to remind folks when they ask me, nothing's changed. The virus is here. We're smarter. We're wearing masks. So maybe that part's changed, but the virus hasn't. It's here and spreading. So all the same precautions. And until we actually have a vaccine, which likely December at the earliest. So that's further away than when we started this whole thing. And I just like to give that perspective. Do you have any specific insights from other emergency managers, the doctors and so on that are providing support and guidance at Department of Health? Anything that specifically relates to Duval, our downtown area, businesses, many of them look like, I use the hardware store as a good example of, they have wash stations outside, glove, mask if you want it. The trail's open now, but people still need to be cautious. Any advice that you can give our citizens?
Oh boy. Well, I think, the biggest thing is trying to maintain social distance and masks. And something I didn't mention is that we did get a delivery of 3,000 masks for community distribution from King County. So we're working with our Medical Reserve Corps. We distributed about 500 of those to businesses directly, either for them to use or them to distribute and have available for their own customers. But we are working on that. So again, just reinforcing those indicators. Hey, let's try to have good hygiene, wash your hands, keep distance. And I think a lot of people are doing that reluctantly or not. I think everybody has feelings about, what's best for them. But I think people are still kind of trying to follow some social and societal norms, right? The more we see somebody doing something, the more it becomes an adaptive behavior. But again, I think just trying to follow those best examples and washing your hands. And we've seen other businesses or other chambers and provide sanitizer. Again, having all those items available for use. So whether it's hand sanitizer on the corner or at every entry, I think those are important kind of social supports that I think we would recommend that we continue and want to support.
Well, thank you, Sean, for reinforcing that. Councilmember Naplin has a question.
It's just real quick. You were saying that you had distributed them to the community, some of the different businesses. Have you considered having a distribution at the farmers market potentially? I'm just thinking that might be kind of a neat place to encourage people to come down. And I just want to report, I was talking to the manager or director of the farmers market, and they're just doing a tremendous job down there in the new location. It seems to be working well. They've had a few kinks to work out. But anyway, that just popped into my head that might be a neat place to distribute some.
Yep, absolutely. That was one of the ones on our list. So I asked our volunteer Medical Reserve Corps folks, hey, here's where I think we would like to see them done. At Farmers Market was one, Safeway, Family Grocer, those places. And so now we're trying to actually have an email from that individual right now and just waiting to see where they're willing to do it or where we want to. So, and we also have to package them. So we need to package them in bags of 8 for a household or something. So
it's a nice resource. How many did we receive again, Sean?
3,000.
Wow.
Reusable cloth face masks. They're white.
Yeah. Well, that's sure good news. Well, if there's no other question, Councilmember McHenry has a question.
Thanks. So in addition to the masks, I'm a chamber member, so I had seen an update about the city paying for color posters for businesses, and I hadn't seen that in a communication, so I just didn't know if the other council knew that. I think that's a great way to support businesses, so I just didn't know if you wanted to mention that, and also if there are any other things like that that the city's doing for businesses right now.
Yeah, so those things, no, I probably did not communicate that. There's a lot of things in the air, but that came about with discussions with, we've been really involved with Natalie in the chamber and sort of that liaison. And so in some sort of discussion, she had mentioned how they were working on getting these care packages or they're trying to get some stuff out. And I said, well, that's somewhere the city can help. So I said, let's do this. And and can we put together these mask packages, and it kind of is like a reopening kit. And it's not as fancy as some of the other cities have done so far, but it was something that we were able to just in 2 days span kind of agree upon and figure out really quickly and set out. So I hope that was useful to the businesses that utilized it. I think they were allowed 10 posters because they all have required signage. And that's a small cost, but it's something that certainly we can assist with, and we can help out and at least help remove that burden for them. So, and we are absolutely interested in continuing to do that with the chamber.
Yeah, I think it's a great idea. And I just thought it was a really nice gesture to these businesses where even just one extra thing that they have to get up before they reopen can be a huge burden for them, whether it's money or time or both.
Yeah, absolutely. If I had a steady supply of hand sanitizer, if I knew I could commit to that and I could provide it, we would absolutely do it. But I'm not sure that I have a source of that's that reliable yet.
Right. Thank you.
Councilmember Naplin.
Sorry, just a follow-up. That's such a great program. I love it that you're doing that with the chamber, but it occurred to me, since I didn't know about it, that maybe the businesses that don't belong to the chamber are not aware. And I just know there's, quite a few businesses that for one reason or another aren't or can't belong to the chamber. And I don't know if there's another way to reach out to those businesses to let them know about the program. It really sounds like a neat program.
Yeah, absolutely. Yeah, it'd be a good vehicle for social media. Again, getting that one pushed forward, and then at least chamber did that part for us, right? All we had to do is pay the money and provide the bags and masks. I did that at my house one night, just stuffed them in a bag. But absolutely, we would be happy to offer that. Generally, chamber was just an easy vehicle, but you're right, and definitely understood that we were missing anybody who's not a chamber member. So,
Other comments or questions for Sean? Well, Sean, just on behalf of council and our community, I just want to say thanks again. This pretty unprecedented in my own lifetime, and it's something that impacts everybody every day. And it's nice. I was looking at our website again, and you've done such a nice job of providing links and information for folks, and helping us to understand through these presentations where we're at with our phases and what we can be doing to help protect ourselves. But the technical information we as council need as well, to be able to really look at things. I know this is a lot of work. You've got your main job, and on top of that, you do work for us as our PIO, releasing information, providing support in so many other ways. And I know it takes away from family time. And so I appreciate your hard work, and thank you for joining us as often as you do to help give us updates. Thank you.
I much appreciated. Thank you.
Well, with that, council members, we have some extra time, which I think we'd all appreciate. For those that are attendees, at 7 o'clock, we'll be going to our city council meeting run by Mayor Okerlander. And we'll see you there at 7. So with that, we'll sign off and see you in about a half hour. Thank you, everyone.